Penile injections are actually really simple and really easy. A lot of guys get a lot of anxiety before they start using these injections, but once we teach men how to use them, they tend to relax, and a lot of men are quite comfortable and happy using these in the medium and long term. It's important to know the dose of the medication that you're going to be using, so if you're not sure, definitely clarify with your treating doctor. What I recommend for my patients who are using compounded or vials of the medication is to withdraw the plunger on the syringe just in the room air so that you're sucking up an amount of air. So say for example, you're planning to inject 0.1 of a mil. First of all, you suck out 0.1 of a mil of air into your syringe. Then you clean the top of the vial with a little alcohol swab, insert the needle into the vial, and push the small amount of air that you had in your syringe into the vial. Then turn the vial upside down so that all the fluid will come into the syringe when you withdraw the plunger, and withdraw the plunger the 0.1 mil or whatever the amount you need to withdraw. Then set your needle with the syringe and the medication on a flat table, and being careful to ensure that the needle tip doesn't touch anything or become unsterile, because at the end of the day we're going to be injecting that. Infections are a very low risk, but you want to do everything possible to keep everything nice and clean. Give your hands a nice clean, and then get another second alcohol swab and clean the side of the penile shaft. Have a look and be certain where you're going to inject, and I generally recommend to grab the head of the penis and stretch it straight out from the body, or sometimes a little bit off to the side. With your other hand, holding the needle and syringe much like you would a dart, steadily and without hesitation, put the needle into the side of the penis all the way to the hilt. What that means is the whole needle needs to be inside. You can't see any needle poking still on the outside, and that way you'll ensure that the end of the needle is actually really properly within the erectile mechanism, so that when you then press the plunger gently, all of that medication will be delivered to where it needs to go. If you just put the needle a little bit of the way in, it'll go under the skin and won't do what it needs to do. If you hit the water pipe by accident, you might notice a little bit of blood coming out from the penis. It'll settle, and you probably won't get any sort of an erection either. The medication will generally last 5 minutes to 30 minutes or 40 minutes, and it can be variable for each man, and also depends on the medication that you're using and the amount of the medication that you use. If at any stage you notice that the erection isn't going down after several hours, there are some things that you can do to try and get it down. But if it's not working and it's still up after 4 hours, that's called a priapism, and you need to go and see an emergency department to get that treated, because it is an emergency. If you leave that as is, you will get permanent problems with erections going forward. So any prolonged erection, absolutely you need to present to an emergency department for treatment.